Hi everybody, I'm Joanne MacInnis from Aberdeen Home Care. I want to talk to you about what's going on with the coronavirus, COVID-19. There's a lot of information out there from a lot of would-be experts. This morning I had the opportunity to be on a conference call with Dr. Lawrence Madoff, who is the medical director for the Massachusetts Department of Public Health. We were able to listen to the up-to-the-minute information about what you need to do to stay safe, to reduce your exposure, and what happens if you feel you have symptoms that might be what the COVID virus is all about. So number one, removing the risk is keeping yourself away from other people. The whole notion of social distancing is a real thing. This is an airborne illness. You don't need to cough or sneeze to be able to breathe in air that other people are exhaling and therefore make you vulnerable. So social distancing is a real thing. Stay apart from people. Don't go anywhere that's not absolutely urgent. Stay at home. The second takeaway point was that food preparation being done by other people is very close in proximity to people's faces and their hands. They may be using gloves and they may be collecting money from on one hand and making your sandwich with the other. You don't know. I don't know either, but it's a risk you don't need to take. Stay away from takeout, stay away from restaurants, stay away from anybody preparing your food other than yourself. And the third issue is, what if you think you or a loved one has been exposed or is coming down with the symptoms that are associated with COVID-19. Your first and most important thing to do is to socially remove yourself from other people, socially distance, put yourself on quarantine. The second point in that category is to call your healthcare provider. Ask them specifically for direction. They will direct you to quarantine, which you've already done. Ask them, what is my next step? If you are ill and you feel like you need symptom control, cough medicine, or antihistamines, or pain relief, ask specific questions when you call. You'll speak to a receptionist or someone answering the phone. You probably won't speak to a clinician. If you feel you're ill, ask persistently to speak to a clinician. Number three, I know people are going to urgent cares and they're being sent away. It's not recommended that you go to a medical facility right at this time because the systems are overwhelmed. Use your primary care physician. Ask them, what is your next move if your symptoms become unmanageable? You always have 911 to call, but remember, we don't want to overwhelm the medical system so that people that are really in a crisis can't get the help they need. Stay tuned because we'll be posting up-to-date information. We're in touch with the CDC and the Mass Department of Public Health constantly. Stay tuned to Aberdeen Home Care. We want to make sure you get the facts.